Today we'll be analyzing some of the scariest NFL injuries in recent history. And no, this is not an NFL team, but I love me some Red Blacks, so sue me. American football is one of the most smash-mouth sports on the planet, and as such, any NFL player will tell you, injury is very literally part of the game. Hell, even when a player is deemed healthy and flying around the field making plays, there's a good chance they're dealing with some level of pain, sprain, or strain somewhere on their body.
Evo yet to touch it. McCaffrey, he goes down, and he went down right away, and he is heading off. Something was wrong right from the jump.
Let's just say Christian McCaffrey is no stranger to bumps and bruises. As one of the league's premier running backs, his 5'11", 210-pound frame takes a beating every single game, bro. Many of you will remember him falling to the ground, suffering no apparent contact a couple of weeks ago versus the Bills. In the moment when he fell, many assumed a problem with C-Mac's left Achilles, as he's had problems with his tendon in the past, citing a momentary bulge in his left calf muscle as a muscular rebounding effect from a ruptured Achilles tendon. And while an Achilles that has suffered low-level damage in the past is more prone to rupture, C-Mac isn't pushing off through the left Achilles tendon with any real force as we might expect were this the location of the injury. And as it turns out, the injury wasn't Achilles related at all. On the previous breakaway run, Christian landed on his right knee in a very unlucky manner.
As he lands, that's going to put a force in this direction, pushing his tibia posterior relative to his femur.
As always, shout out to my colleague in YouTube medicine, Brian Sutterer, for his prompt sports injury analyses. Basically, when the knee is held deep in flexion, the tibia, or your shin bone, protrudes slightly beyond the end of the femur, or the thigh bone, such that it comes into contact with the ground before the femur does. Suddenly, C-Mac's shin bone comes to an abrupt stop, while the femur continues forward with the momentum of his whole body behind it, as the PCL ligament, which connects the two bones, hangs on for dear life. This is the exact mechanism of injury for the PCL in frontal motor vehicle collisions, the so-called dashboard injury. After being diagnosed with a posterior cruciate ligament injury, McCaffrey returns to injury reserve, doubtful for the remainder of the season. He said in a recent Instagram post, "You can do everything right and still fail. That's life and that's football." And I mean, yeah, especially when you touch the ball as many times as he does. The NFL certainly isn't a gentle place. Now, Coach Shanahan did mention the possibility of a C-Mac return should the Niners make the playoffs, which tells us A, that the injury is either grade 1 or 2, that is to say, not fully torn, and that B, they're treating it non-operatively for now. If surgery were necessary, we wouldn't be seeing McCaffrey again for at least a year. Unfortunately, he's not the only one whose 2024 season may be over. But before we go on any further, remember, each incidence of physical trauma in this video is carefully contextualized within a lesson on human anatomy. Jaguars versus the Texans. A sliding Trevor Lawrence suffers a brutal hit as Al-Shaair attempts to contest the first down conversion. It didn't take a doctor to tell viewers that something was very wrong. Here we see Lawrence posturing, which refers to a specific type of abnormal body positioning that can occur in people with severe brain injuries or neurological disorders. There are two main types of posturing: decerebrate, which is characterized by straight tense arms and straight rigid legs, and decorticate, with arms bent towards the center of the body and straight rigid legs. When the brain is injured, it can lose its ability to regulate muscle activity, leading to an imbalance of excitatory and inhibitory signals. This can cause muscles to become overly active or rigid, resulting in abnormal postures. The moment after Lawrence is hit, we can see this process at work. Think of it like a loss of brake control in the brain, allowing reflexes to take over and cause the body to adopt unusual positions. You'll notice, however, that one of Trevor's arms is straight while the other is bent, exhibiting a hybrid form of posturing known as fencing, aptly named as it resembles the on guard stance taken during fencing contests. After a hit like this, the stadium holds its breath as though everyone instinctively understands how important prompt medical attention is for a player to make a full recovery. Care focuses on stabilizing their airway, breathing, and circulation, as well as managing pain and monitoring neurological status. Imaging studies and surgical intervention may be necessary, and a multidisciplinary team will work together to address the complex medical and rehabilitation needs of the patient. Think about it. When Al-Shaair bashes Lawrence's face mask with his forearm, he causes the brain, which is floating in cerebrospinal fluid, to literally ricochet off the inner wall of the skull. Coup contra coup, which essentially means 2 hits to the brain for every 1 external impact. So yeah, when Trevor's head smashes backwards into the ground, the brain is rattling around for another couple of bumps. Something like 4 or more times in the span of a second? That is precisely how you spell concussion. Despite the NFL's attempt to crack down on hits that cause injuries like this, Lawrence isn't the only fencing quarterback in recent memory.
Rolling left with the grain, and down he goes.
I mean, this is a sack, fair and square. But the whipping motion as the defender swings Tagovailoa to the turf causes his head to snap back, just like whiplash when some jackweed rear-ends you in a parking lot. Boom! Not a good look, especially considering this was his 3rd official concussion in recent history.
You think about the back, the ankle, but he gets thrown to the ground.
Tua was back on the field in 2024, where he sustained another scary hit from Damar Hamlin of the Bills. The posturing response isn't quite as dramatic, but it's still obvious that something is wrong here. It's no wonder many fellow players think Tua should consider early retirement. Sure, in the short term, concussions lead to fleeting symptoms like headaches, dizziness, and confusion. But the story doesn't end there. Recurring concussions can have serious long-term consequences, including CTE, or chronic traumatic encephalopathy, a degenerative brain disease that affects memory, mood, and motor skills, and increases the risk of future concussions and conditions like Parkinson's disease. The scariest part is that CTE symptoms often appear years or decades later. Although Tua took some more time off this year, he has since returned to play. I sincerely hope he continues to perform well and is able to remain healthy for the rest of his career. He's already made it crystal clear that he's willing to take the risk.
There are a lot of people out there legitimately worried about your health and making sure that you're okay. What would you say to those that are worried?
I appreciate your concern. I really do. I love this game, and I love it to the death of me.
Well, damn. I'm not entirely sure how to respond to that. So let's just move on to our next patient, who, in some ironic twist of fate, happens to be Damar Hamlin. Remember? The very player who delivered Tua's most recent concussion. The wide receiver T. Higgins lowers his right shoulder into Damar Hamlin's chest for what seems like a very unremarkable tackle. Hamlin stands up after the play, but the next time the camera pans back to him, he is lying on his back with several medical personnel gathered around him. When it's difficult to identify an obvious mechanism of injury, we literally assume the role of detective. The announcer explains that Hamlin was only on his feet for a few steps before he collapsed. Then suddenly, an ambulance is on the field.
They have been administering CPR through these past 2 breaks that we've taken.
This is always a scary prospect. When someone receives CPR, or cardiopulmonary resuscitation, it's often because their heart has stopped beating or is not beating very effectively. Medically, this indicates that the person is in cardiac arrest and their body is not getting enough oxygen. The manual compressions of the chest assist the heart by pumping blood and oxygen through the body, buying time until medical professionals can provide further treatment, such as defibrillation or advanced life support. Damar Hamlin's situation was a stark reminder of the importance of prompt medical attention. The 16 minutes it took to stabilize him on the field before rushing him to the ICU, where he would spend several days, were crucial in mitigating the risks of hypoxia, or oxygen deprivation, and ischemia, insufficient blood flow. The consequences of delayed treatment are dire. Our most vital organs, particularly the oxygen-dependent brain, can suffer irreversible cell damage within minutes. The rapid response of medical staff was instrumental in preventing long-term damage.
Often that's how it is. It's not necessarily about a big hit, it's about the type of hit.
She's onto something with the phrase type of hit. Anyone heard of commotio cordis? A rare but serious condition that happens when a sudden blunt force to the chest, like a hit or a blow, occurs at just the right moment during the heart's rhythm. This impact can cause the heart's electrical system to go haywire, triggering irregular rhythm or arrhythmia and ultimately cardiac arrest. This is a once in a blue moon type of occurrence. The blow must be over the heart, occur during a precise moment in the heartbeat within 20 to 40 milliseconds, which is faster than the blink of an eye, by the way, and be of just the right intensity, not too hard or too soft. Then, unless witnesses recognize what is going on, start CPR, alert emergency medical services, and use a defibrillator immediately, the patient will die. Thankfully, Damar Hamlin has an angel watching over him, having returned to the field a healthy playmaker in Buffalo. Of course, there are some injuries that are far more obvious. Keep your eyes on Keaton Mitchell, the Baltimore running back.
That sack that he had in the first half, 24, is a big impact in this game. Keaton Mitchell almost...
Did you catch that? One might sum this injury up by saying simply, the knee isn't supposed to bend that way. If we slow down the footage, we see Mitchell stumble out of a broken tackle and plant his left cleated foot awkwardly into the turf. A well-timed pause reveals extreme hyperextension of the left knee. You see, the knee joint, like other hinge joints on the body, is designed to bend and straighten within a certain range. But when it's forced beyond that range, the ligaments and tendons that hold it together can stretch or tear. The anterior cruciate ligament, or ACL, is particularly vulnerable to hyperextension injuries. The ACL runs diagonally through the knee joint, from the posterior or back aspect of the femur, thigh bone, to the anterior or front aspect of the tibia, shin bone. When the knee is forced into hyperextension, the tibia is angled backward relative to the femur, which causes the ACL to be stretched or pulled taut, while the head of the femur effectively acts like a very dull cleaver, cutting across the already stretched tendon. As you might expect, Mitchell knows something is wrong immediately following the play. Unfortunately for him, there's a little more to our assessment. The PCL, or posterior cruciate ligament, is also at risk during extreme hyperextension of the knee, but for opposite reasons. It runs diagonally through the knee joint from the anterior or front aspect of the femur to the posterior or back aspect of the tibia, in direct opposition to the forces exerted by the ACL. When the knee is forced into extreme hyperextension and the tibia is angled backwards relative to the femur, the PCL can be excessively tensioned or stretched enough to cause damage. This tension can lead to damage or rupture of the PCL, especially if the force is excessive or the knee is bent at an awkward angle. I do believe those conditions have been met here. Ultimately, it was only a torn ACL. Thankfully, kinda. I mean, as we've discussed, it could have been 2 ligaments for the price of 1. Mitchell did end up requiring surgery and was out for the remainder of the season. Judging by the extent of hyperextension, this was likely a grade 3 or a complete tear. Ligaments are fibrous connective tissues that provide stability and support to joints, but they are not very flexible, and they can't be in order to serve their function effectively. After an ACL reconstruction, recovery is long and arduous, as Mitchell told reporters. Everybody comes up to me and says that it went by fast. To me, it didn't go by very fast. It seemed like it took forever. It was a grind every day. And well, such is life when you're working with a new knee. While most professional athletes can return to competition within a year of surgery, several studies suggest that it may take up to 2 years for those athletes to return to their pre-injury level of performance, suggesting that there is something other than just the physical rehabilitation that is at play. Now, can anyone tell me a type of tissue that has a much more favorable healing prognosis than ligaments?
I'm gonna keep it. Prescott breaks the tackle.
If you answer bones, you may have a future in medicine. Lord knows Dak's lower leg isn't gonna straighten itself. We see Dak falling to the turf with the tackler Ryan hanging off of him. Dak plants his right leg, and Ryan's knee swings into the external aspect of his low leg right above the ankle joint. The weight and momentum of Ryan's body is transmitted through his knee into Dak's leg, exerting a bending and rotational force on both the tibia and fibula simultaneously. Dak banging his foot into the ground as if to push the bone back into place surely won't help the situation. Adrenaline is one hell of a drug. Endogenous too. I'd wager Dak remembers this moment as surreal, quite like a dream. When the fracture is so obvious that the bones no longer help to maintain the structural form of the leg, that is, when the lower leg looks like a wet noodle, we're dealing with a complete, displaced, or out of normal position fracture, and sharp edges of bone where the break has occurred that could potentially puncture the skin. Before the medical personnel can remove Dak from the field, they need to establish a couple of things. Is the fracture open, with bone poking through the skin, or closed? If it's open, how open, and therefore how prone to contamination is it? How stable is the leg? Should we try to move him? Because once that adrenaline wears off, moving a patient whose leg is wiggling around is quite uncomfortable, believe me. We also need to assess if there has been any vascular compromise. Or in other words, are the bones pushing on, or have they lacerated or severed veins or arteries compromising the blood flow? We can see by the time that Dak gets on the cart, he's wearing a splint, and a preliminary or partial reduction has taken place. We can't perfectly align the bones outside of the operating room or a trauma bay, but this will help to make the pain more bearable during transportation. He was diagnosed with a dislocation of the ankle joint and a break in the bones, specifically the tibia and fibula, which form the sides and the top of the joint, with the bone fragments breaking through the skin, making it a compound or open fracture. This type of injury is considered more serious because of the risk of infection from the open wound. Dak's injury required immediate reduction to realign the bones and a surgical procedure to stabilize the joint with plates and screws.
Kid right there's never missed a start, Jim, his entire career.
Thankfully, Dak is a trooper and would successfully recover from this injury. If you found anything in this video educational, then all I would ask is that you leave a comment and give it a big thumbs up to feed the algorithm. This will help us to grow the channel so that we can create more engaging videos about human anatomy for you. If you didn't like the video, be sure to let me know why in the comment section down below. Your comment just might help us to make our videos better for you. We're working towards a goal of 1 million subs, and we would love to have you with us when we get there. Don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Or its sister channel, Human at Home, where we show you how to be healthy in the space where you live. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.